Welcome to my channel. In this video, we will explore constipation, its causes, management strategies that actually work, medications for those tough moments, some tips for the instant relief and when to seek medical attention. Before we dive in, subscribe to my channel and hit the notification bell for more health-related videos. Constipation is one of the most common digestive problems in the United States. At least 2.5 million people see their healthcare provider each year due to constipation. Generally, constipation is considered as infrequent bowel movements, but having less than 3 bowel movements per week is the medical definition of constipation. Other key features include your stools are dry, hard, or lumpy, and are difficult or painful to pass. You may have abdominal cramps, nausea or bloating, feeling of incomplete emptying after a bowel movement, straining to start or complete a bowel movement. To be able to treat and prevent your constipation, it is very important to understand all the factors contributing to this problem. Constipation happens when your colon or large intestine absorbs too much water from your poop. When your stools pass through the colon at a slow speed than they should, or bowel movements are sluggish than usual. This gives your colon more time to absorb large amount of water from the stool, and it becomes dry, hard, and difficult to push out. There are many causes of constipation, including lifestyle factors, medications, and medical conditions. The most common lifestyle changes that can lead to constipation include having a diet low in fibers, and dehydration are the most important leading factors. Low levels of physical activity can also lead to constipation. Some past studies have found that physically fit people, including marathon runners, are less likely to experience constipation than other people. Changes in your regular routine, such as traveling or eating or going to bed at different times. Aging, stress. Resisting the natural urge to have a bowel movement. Certain medication that can cause constipation include opioid pain medications, antidepressants, including selective serotonin reuptake inhibitors or tricyclic antidepressants, antacids containing calcium or aluminium, iron supplements, allergy medications, such as antihistamines, certain blood pressure medicines, including calcium channel blockers, beta blockers, and diuretics. Certain medical conditions, having a blockage in the colon or rectum, like intestinal obstruction or rectal cancer, having problems in the nerves around the rectum or colon, like spinal cord injury, conditions that affects body hormones such as pregnancy, diabetes, hypothyroidism. Now let's discuss the most important part of this topic that will help you manage your constipation effectively. Treating constipation mainly include 3 important steps: dietary changes, lifestyle modification, and medications also called laxatives. Changing your diet and increasing your physical activity level are the most important and the easiest ways to treat and prevent constipation. Drink 2 to 4 extra glasses of water a day. Avoid caffeine-containing drinks and alcohol, as they can cause dehydration. Also, avoid high-sweetened beverages. Add fiber-rich foods to your diet. Fiber adds bulk to stools, which helps to promote more regular bowel movements. Fruits rich in fibers and water include apple, kiwi, pear, raspberries, blackberries, papaya. Vegetables are a rich source of insoluble fiber like broccoli. Include whole grains, beans, pulses, prunes, or bran cereal. Your daily intake of fiber should be between 20 and 35 grams. Avoid processed foods, fried foods, and refined carbs like white bread, pasta, and potatoes. Avoid high-fat foods like meat, eggs, and cheese. Lean meats like poultry and low-fat dairy products can be taken. Include probiotics in your diet. Studies have shown effectiveness of probiotics as a treatment for constipation among elderly adults. Probiotics are beneficial bacteria that may help to improve gut health and soften stools. Probiotics that contained bifidobacterium appeared to be the most effective. Many dairy products, including yogurt, contain probiotics. Increase your physical activity. Aim for about 150 minutes of moderate exercise every week, with a goal of 30 minutes per day, at least 5 times per week. Avoid holding the urge to use the bathroom. Eventually, it will block the signal from your colon to your brain to relax and let the poop out. Bowel training can be helpful for individuals with chronic constipation. It is done by setting a routine for bowel movements. This means trying to have a bowel movement at the same time each day, preferably after a meal. Most doctors recommend going to washroom in the morning, about 20 minutes after eating breakfast. Spend 10 to 15 minutes in washroom waiting for bowel movement. Make sure you don't strain as you try to go. Practicing relaxation techniques like deep breathing or meditation, it can help reduce stress and create a more conducive environment for bowel movements. Some people find it easier to pass stools if they place their feet on a low platform, such as a step, with their knees above hip level or squatting position. After all the lifestyle and dietary changes, now, let's talk about medications commonly called as laxatives given to treat constipation. Laxatives can be taken orally, by mouth, in the form of liquids, tablets, or capsules. They can also be taken through the rectum, for example, suppositories or enemas. There are mainly 4 types of laxative with different mechanism of actions. Bulk-forming laxatives work by increasing the bulk and weight of stool, making it easier to pass through the colon. They take 2 or 3 days to work. This is the safest option. Bulk-forming laxatives include ispagula husk or methylcellulose. Osmotic laxatives draw water from the rest of the body into your bowel to soften stool and make it easier to pass. They take 2 or 3 days to work. Lactulose and polyethylene glycol are the most commonly used osmotic laxatives. Lactulose, widely available by the brand names Dufalac. The recommended dose of lactulose for adults is 15 to 30 ml once or twice daily, usually given before sleeping. Stimulant laxatives stimulate bowel movements by increasing the contraction of the muscles that line your gut, helping them to move poo along to your back passage. They take 6 to 12 hours to work and are considered as fast-acting laxatives. Bisacodyl is a good and safe stimulant laxative that is available by the brand name Dulcolax. Bisacodyl is a useful laxative, especially suitable for single-dose use in patients with temporary constipation. Another example of stimulant laxative is sodium picosulfate, widely available under the brand names Cremafin. It is quite effective but can cause diarrhea and loose stools. Stool softener laxatives work by letting water into poo to soften it and make it easier to pass. However, they're the least effective option for treating constipation. They're best for people with temporary constipation or mild chronic constipation. They include arachis oil, docusate. One should always start treatment with a bulk-forming laxative. If it does not soften your stool, try using an osmotic laxative in addition to, or instead of, a bulk-forming laxative. If your stool is soft but is still difficult to pass, try taking a stimulant laxative in addition to a bulk-forming laxative. Bloating, diarrhea, dehydration, abdominal cramps, rectal irritation, and nausea are the common side effects of laxatives. Laxatives are usually not recommended for children, unless advised by a doctor, and people with certain health conditions, such as Crohn's disease or ulcerative colitis. Please seek medical attention if constipation starts suddenly without a clear reason. Ongoing constipation not responding to lifestyle changes. Blood in the stool, constant pain in the abdomen or lower back or worsening of symptoms. Difficulty in passing gas, vomiting, unexpected weight loss. Sometimes you need instant relief. Here are a couple of quick fixes. Drinking a glass of warm water or herbal tea can help soften stool and stimulate bowel movements. Gently massaging your abdomen in a clockwise direction may help stimulate the colon and promote bowel movements. Prune juice is a natural laxative due to its high sorbitol content. Drinking a small glass of prune juice can often help relieve constipation within a few hours. Glycerin suppositories can provide rapid relief by softening and lubricating the stool, making it easier to pass. Follow instructions on the packaging carefully. In severe cases, a rectal enema can be used to clear the lower colon quickly. This should only be done under the guidance of a healthcare professional. When on the toilet, consider using a step stool to elevate your feet. This mimics a squatting position, which can make it easier to pass stool. If you found this video informative, please give it a thumbs up, share, and don't forget to subscribe to my channel for more health-related content.